Welcome back, everyone, on this Sunday morning to our Get the Facts on the Vax special. Governor Ned Lamont and DPH Acting Commissioner Dr. Deirdre Gifford are answering the questions you have sent to us. Thank you both for being here to tackle these important concerns. And I want to get right to it. People who get the Pfizer vaccine get the second dose 21 days after the first. So those who get Moderna are due for the second dose 28 days later. What is the state doing just to make sure those second doses are available? Governor, can I start with you?
Start with me. Josh and Deirdre track very closely. We know exactly how many vaccines we're going to get from the federal government, whether they go to our frontline health providers or they're going to pharmacies as well. The federal government holds back and they send the second doses 3 weeks later for Pfizer and 4 weeks later for Moderna. So they track that, and we make sure that you're contacting and say, now you've got your appointment for the second dose. Now's the time to take the vaccine.
And speaking of the second dose, Nancy in Manchester, who had COVID, wrote in expressing concerns about getting a second dose. She wants to know if she really needs the second vaccine. She says some of her coworkers got sick with fever, aches and chills after the second dose. And she says she was very sick with COVID when she had it. So can you address, Doctor, maybe this might be the best question for you, about why people are having a second dose reaction and why, even if you've had COVID, the recommendation is that you should still get the vaccine?
You're correct. The recommendation is, even if you were sick with COVID, that you go ahead and get vaccinated when you're eligible. And that's because we're not exactly sure how long the natural immunity would last after an infection. So it's important to go ahead and get that vaccine to make sure that you keep that immunity to the COVID illness. In terms of the second dose, it's common after many vaccines, not just this one, to have some mild side effects, pain in the arm, maybe some aches or low-grade fever or fatigue. And those are temporary. They last for a day or two. But we don't want people to skip their second dose of vaccine. It's really important to complete both doses to make sure you're fully immune.
In fact, I've been told by some doctors that actually that feeling you're getting, that is an immune response. You should consider it a good thing that your body is building immunity when you're feeling like that. Is that correct?
It's certainly a typical and not uncommon response after vaccination, and people shouldn't be overly concerned about those side effects.
Okay. And now to a question from Cindy. She'd like to know if you have to wait 3 months to get the vaccine after having the virus, or can you get it right away? That's a good question for those of us who are in that 3-month period having recovered from COVID. Should we wait or go?
Well, there's
Deirdre, what do you think?
There's no specific time frame around waiting. Some clinicians have said wait 90 days. What I would encourage people to do is talk to your doctor about your specific circumstances there.
All right, Dawn and Meriden asking if you can get COVID after getting the vaccine. Can you still get it? And I guess we know that it's 95% effective, but basically 100% effective, we're hearing from the stats, on protecting against serious illness. Is that what you both understand?
Yeah, my understanding is, look, the vaccine will keep you out of the hospital. The vaccine will 100% prevent these fatalities for all those most severe things. Is it 100% preventing you from getting a mild case and infections? It's not, but it's still incredibly effective, keeps you out of harm's way, and that's the important thing to know.
Yes, Doctor, would you like to add to that?
Yes, just to add to the governor, it's really remarkable, the effectiveness of these vaccines. They are tremendously, nobody in the clinical trials passed away from COVID. Who received the vaccine. So it's really a phenomenal development. And we certainly, as the governor said, encourage you to get the vaccine because it's the best way we have to prevent severe illness and death.
Now, we have received phone calls from several people who do have medical conditions. They're wondering if they should get the vaccine. There was a man with cancer who called who was actually undergoing chemotherapy. Should people who are in the midst of this kind of treatment get the vaccine? And also, how about people who have histories of bad reactions to flu or other vaccines? Doctor?
Yes. So there are very few people that are advised not to take this vaccine. a known allergy to one of the ingredients in the vaccine is the very small group of people that may not be eligible. Other than that, you really should talk to your clinician if you have concerns about whether or not the vaccine is right for you. But it's a pretty small group of people who are being advised not to take the vaccine. Even if you've had an allergic reaction in the past, you might be asked to stick around a little bit longer after your shot to make sure you don't have any reaction to this one. But talk to your provider and get that reassurance.
Thank you, doctor. Thank you, governor. And as more and more people get vaccinated, the big question we all want to know, what will life be like? The governor and Commissioner Gifford give us a glimpse at our future right after this quick break.